We'll see you all. All right, everyone, welcome roll. And thank you, everyone.
We can if you want. But so we're building Roll. Roll is an AI-enabled healthcare back office for clinicians. Is there a clicker?
No, just hit the right arrow.
So our motto is patients, not paperwork. Ideally, we want to keep doctors with patients, eliminating as much back office work that they currently have to do. And this is leading us to build our first product, which is an AI medical scribe.
Now, so as I'm sure if anybody here is in healthcare, healthcare administrative costs are incredibly wasteful, to the tune of about $266 billion a year. That is estimated to be completely wasted on a lot of things that could be done a lot quicker. If we go to the next slide. So the problem, 35% of physician time is spent on administrative tasks. In the ER, it's a little bit higher from the surveys that we've had and people that we've talked to. Anecdotally, it indicates as high as 50% spending on just completing the reporting that they should have done while they were with the patients, but because the volume is so high, they just don't have the time to do it. The average patient visit in 2023 was 13 minutes. I don't know about the rest of you, but I've had very many times when my average patient visit was 4 to 5 minutes that I actually got to spend with the doctor. So, in my opinion, that's a problem that needs to be fixed, and healthcare costs just keep rising due to inefficient incentives.
So we're essentially building a AI medical powered back office for these healthcare clinicians. Our first product is an AI note-taking app that allows a patient and a provider to essentially record their entire conversation, automatically generating the notes for the provider, saving them almost 2 to 3 hours per day, especially in hospitals and ER situations. Long term, we want to basically build an entire solution suite for healthcare clinicians, hospitals, etc. that basically replaces a lot of their back office work that's taking a lot of time and inefficiency.
One thing I also want to touch on, apart on what Chad just mentioned, is we want to have a two-way interface. So in the beginning, we're going to start off with the clinics and physicians, where it's essentially going to record a patient interaction, generate the SOAP note, connect directly to their EHR. We also want the patient to have a patient side app where they're going to be able to see in real time their treatment plan, what the doctor did, what the notes they made, so that everything is kind of current.
And so this kind of like goes over a little bit of our market opportunity. The AI note-taking app specifically is set to grow at approximately $5.5 billion by 2030. Healthcare IT in general is around a $100 billion industry, so we're playing in an incredibly big market here. And even in the United States alone, there's almost 200,000 active physician groups, and these are our initial target customers. So our founder advantage is that we not only have experience in the healthcare space and healthcare automation space, but we are one of the first movers in building AI first agent platforms and AI agent solutions that are specifically leveraging this cutting edge AI. And we're located in Florida, right? So here in Florida specifically, there's almost 17,000 active physicians group, which is the most out of any other state, even states like California, which have a much larger population. This is our initial customer, just this tech forward thinking physician that wants to automate his practice and make things more efficient and save money on his side. So our go-to-market is really targeting these tech forward-looking physicians and optimizing areas that have been traditionally left behind by the healthcare industry in general, like SEO, digital marketing, etc. Right now, a lot of the healthcare market is driven by direct sales, which we will do, but we also want to capitalize on some of these digital marketing strategies that just aren't currently being leveraged.
And one thing I'll touch on that is, because we have connections within the industry and we've been doing surveys, we've also noticed that there is an entire cohort of these physicians that are kind of looking for these sorts of solutions online and not finding them. Private equity is very big in the space, but in our opinion, they're about 5 years to a decade behind, because why hurt a market that you've already captured? But in terms of SEO, digital marketing, and being able to actually find these solutions, there are entire, literally Reddit threads of doctors trying to find something, arguing about which one works, and basically just saying, so we kind of looked at those and be like, hey, we can pretty much build exactly what you're requesting.
So this is just an early, some screenshots of our early MVP that we're currently testing with a few doctors. So.
Yep, yeah, you want to just go back to my real quick?
Yeah, of course.
So This is what shows up when you open up your phone, you press one button. Basically, this is just a YouTube conversation that we just let it run and record it, so it's able to split apart the voices. You can have as many as 3-4 people in the room, it doesn't matter. There can even be music playing at a low volume in the background because some practices do that, it still picks it up. And at the end, it just provides a soap note. It's also going to be able to link to your EHR depending on which one you use to actually, populate that data.
And so a little bit about, I guess this is more of like a fundraising part, but why back us that first founder mover advantage? 1 minute, cool. There's little to no management in the clinical space right now, and we see ourselves as essentially riding a wave in this, not only the AI opportunity, but the opportunity to help automate and make more efficient a really old business.
The teams too as well.
So we want to help us turn this into this happy doctor right here. And so this kind of touches on our team.
Too young to be happy as a doctor.
Yeah. So our team, myself, I'm Chad Maycumber. I have a 7-figure acquisition under my belt with my first startup, Horizons. Andrei has experience in the healthcare automation space. We have Larry Pino, who is our chief advisor, and he's got a bunch of entrepreneurial experience himself. Dan Reyes, a strategic provider of GoLance, which is a $1 billion talent acquisition marketplace. And Jamie Turner, who is the CEO of Convex and backed by A16Z, Andreessen Horowitz. Maybe you guys have heard of him. So that's our pitch. Thank you, guys.
Thank you very much. Okay, we've got some questions. Mary, go ahead.
Yeah, thank you for presentation. It's really interesting one. I was wondering, I have several questions. How do you manage the medical data? The DICOM standards, HIPAA standards. This is the first thing. I can't see the main person here in the field, the one who is integrating actually the algorithms and everything.
Oh, that's me.
Oh, that's
Yeah, that's me.
Okay.
So,
questions for you?
yeah, of course. So we're totally HIPAA compliant, right? So we're using end-to-end encryption with everything. So everything under HIPAA standards we cover, right? A lot of our infrastructure is on AWS. We've basically checked all the HIPAA boxes.
Wonderful. And how accurate your algorithm is?
So,
It's NLP.
Yeah, it is NLP. So there's basically 2 algorithms, right? There's the transcription algorithm itself, which is essentially taking the conversation and transcribing it. And then there's the LLM model that's essentially generating the notes, right? And we use a combination, probably actually I would consider a proprietary technique that combines the LLM with the transcription. So we basically fix the conversation as it's happening with the doctor and makes it even more accurate. It's hard to put specific numbers on it now because I don't have the test case for you, but I could say from us, this early testing, that it's incredibly accurate.
Yeah, I just want to, we already talked about a fabulous idea. I hope you can pull it off. The only, really, it's just some feedback. We can all read. Don't read the slides. Explain the slides themselves, okay? You guys are pretty good about it. You did read a few, so just don't do that because the audience doesn't like that. Okay? Otherwise, it's a great presentation. It really is a wonderful thing that you're doing.
Yeah, to his point, with so much text on the slides, there's a disparity between what you're going to send out as a deck for somebody to review and when you're actually doing the presentation.
Yeah.
Too much verbiage on the slide means that the audience is going to be reading the slide more than they're going to be listening to you.
Yeah.
The slide is eye candy.
Yeah.
Yeah.
And Rod?
Yeah, so what's your proposed cost and what's the benefit? In other words, if I have a practice and I'm looking at how much it's going to cost my practice to not only purchase, but implement, train, everything, versus what kind of benefits it's going to give me, where does that sit?
Yeah, and I can make that actually really simple, right? So our proposed cost right now is basically $69 a month per user. With that being said, our cost to us
per user. So,
correct. So everybody in the clinician's office, ideally, right? Everybody that they want.
So you've got 20 people in there. You're looking at $1,400 a month.
Yes.
Is it 20 people that are seeing patients on a daily basis?
Well, you got your nurses who talk to the patients. You got your doctors. You got your office staff who's gonna be talking to them. How are
Sure.
you going to define who a user is?
100%. Yeah. So basically, the transcription software specifically can break up the user, and we're using that LLM on top to identify the right person in the conversation, right? So as a user, I have my own iPhone. If I'm having a conversation, I'm a nurse, I'm walking the patient to the doctor's room, right? I can essentially hand off that visit to that doctor, which is on the exact same organization or clinical office. They can pick up the conversation right where it left off. That each patient interaction is roughly 5 cents for us on a cost side, and the doctor is saving between 2 to 3 hours per day, right? So if a doctor has $500 per billable hour, then that's almost $1,500 per day that the doctor is saving. I mean, maybe that's more on the healthcare administration side, but it gives you an idea of like where the cost trade-off is.
So, just advice here.
Sure.
Simplify that out.
Okay.
That's
Yeah.
way too complex.
Yeah, that makes sense.
And so identify, the nurses are users, the doctors are users, nobody else.
Mhm.
Identify who the users are and just simplify it out. Because if I were sitting here listening to this pitch as an investor,
Mhm.
that would just be way too complex.
Gotcha.
I've got to get that within like 10 seconds.
Gotcha.
So,
All right, Sean?
This is a great initiative. Excellent initiative. I'm deeply involved in this. A lot of people are working in this area. I'm glad you are working on it. Before I go further, what is the role stand for?
Oh, the company role?
Role.
The name.
The name.
Yeah, the name. Yeah, no. So originally, it's a funny backstory. We actually started the company as a no-code platform to build AI-enabled agents for any business, and therefore a role in the company, right? And we just kind of kept the name through the transition into healthcare. So it's kind of as like a role in your company.
And AI,
We
take
talk
it back.
about that. First thing is, we do not have a healthcare system in this country. For that matter, around the globe. We have a crumbling sick care system. We're fixing it. We are working on it. It's part of it. And I want to spend some time with you. And, see if I can help you.
That would be amazing. Yeah, we'd love that.
Okay, Bob?
I'd like to see your last slide you have up there right now, split into 6, and in the middle, on the bottom center, question mark, and then who you're looking for, investor, it's like, this is who we're looking for, in the right center.
That's a good idea.
That's a really good idea.
Yeah, I would piggyback on what Rod was saying about the value proposition, because I really wasn't seeing it that well. And the business model, need to get in there. But the one thing that struck me though, excuse me, was I saw a lack of specificity with regard to your target market. Okay.
Sure.
So going to an investor and saying it's a $200 billion market or $100 billion or whatever, and we're going to get a certain percentage of it, that's an immediate turnoff. Okay. And so what you want to do is you need to pick a particular area of the marketplace, right? Whether it's OBGYNs or it's pediatricians or it's oncology or whatever, and just focus on that one market.
Specificity, yeah.
And because once any other doctor in the world sees that you're being successful with one doctor or 100 or 1,000 of them, then they're going to be jumping all over the place. Okay. But you have to be laser focused on that one thing because that's your quickest path to generating revenue.
I would agree. I think that's really good feedback.
Jaden?
Do you guys believe that automating this process will indeed increase the time between doctors and patients?
Decrease, yes. We fundamentally believe that it will help decrease the time between. Or you mean increase the time between?
Do you think it's going to create a benefit the patient-doctor relationship?
Yes,
I
100%.
can
Yeah.
comment real quick. So essentially what it would take away is it would give the doctor back the attention to the patient. So very many times you have the chart, you're turning around, typing in notes, going back and forth, hey, did you do this? Now it would literally just be like a free flow conversation. I'm here with you, the AI is over here recording everything, I can check on it later, but I'm present for you. So that's actually been the feedback that we've gotten the most. It allows them to be present with their patients, so the quality is better.
Jim, and then I've got a couple questions.
So a couple things. So speaking of the market and the market size, so I know from working in the doctor's offices I'm in, They run about 20 to 25 staff, depending on the size of the office. So as part of your presentation, I would think it would be beneficial, to show, hey, the average practice we're in has got 22 people, we have this many users, this is the profit per month, and give people, investors, an idea of this is kind of what the revenue would be per unit. And then take with Rupert, we want to focus first on pediatricians. We want to focus first on. There's this many out of the 17,000 in Florida. Our initial target market is Orlando, the 7-county region here, type of thing, to give some kind of idea of scale.
Yeah.
Okay, and then the other question I have though is, when you do go into the doctor, and yes, you're right, the doctor or the nurse is sitting there typing, is this gonna be made to be able to take that conversation and integrate it automatically into the patient's record?
Yep, that's correct.
So you're trying to eliminate the time that somebody has to sit there and transcribe notes that the doctor may have recorded onto their phone.
100%, yeah. So it essentially eliminates that entirely, and then it takes that one step further by automatically drafting the soap notes for the conversation, right? So after the transcription is recorded, they basically have a web application that does integrate directly with their EHR and then generates a first rough draft of those notes, which the doctor can then go and edit if need be. If he thinks the quality is good enough, it's just him glancing over it and saying, we're good to go.
Right, okay.
Okay, a couple questions myself. One, with my doctor, I've got my chart that I can go in and I can look at all that. I'm assuming that there's a plan at some point to be able to integrate.
Yeah, I mean, our long-term
into
vision,
something like that.
100%. Our long-term vision is essentially taking all of your patient data and honestly combining that with a patient-facing application that gives the patient a better experience too, so that you as a patient can essentially be empowered, right? To have the ability to have an AI, basically medical assistant, book your visits, basically end to end, right? Everything. But it will integrate directly with all of your current patient records, and the AI will be able to give recommendations, surface those to the doctor, and make the entire interaction between the doctor and the patient that much more simpler and that much more powerful and effective.
Okay, and then the other thing that you kind of touched on, that maybe just to think about, you said that, okay, they're walking with the nurse, and then the nurse hands them off, but she's still on her phone. He's still on his phone.
That's why we have multiple users, right? So
Right.
The nurse just downloads the application, they're recording the visit, the doctor's in the same clinic from like a technical perspective, so he just has to continue the visit on his phone, right? So
Okay,
he uses his phone.
So once a visit is initiated.
Correct.
Then that's happening throughout that little.
Throughout the entire
network.
Yep.
And they can say, okay, I'm with this patient, or I'm with this patient, and I'm with this patient.
Correct.
Okay.
Yep.
All right.
Exactly.
We have time for a couple more. Eric?
I was out of the room, so I missed part of this. I know there are companies that will do like voice apps on smart speakers. Somebody put like the whole physician's, or not, the Merck manual into one of these voice apps, and doctors can ask, hey Alexa, is there something that counteracts this drug?
Yep.
How far are we from being able to take like the notes that you have to feed into another medical AI that says this is the recommended?
Yes. No, not far at all, right? So if we would go back to that screenshot and you saw the chat conversation, it's intentionally built to basically support that functionality going forward. So if you can imagine, essentially, I'm sure you're all familiar with ChatGPT at this point, but a ChatGPT interface, it's very specific towards being that AI medical scribe. They can basically, the doctor himself can interact with, ask questions, and surface information about that patient, specifically for that patient, right? And then long term, we'll build the exact same thing for patients themselves, so they can ask their own questions from a medical perspective.
Now, I just want to congratulate you on having Larry Pino.
Oh, yeah.
You know he was an attorney.
Oh, nice.
He
Yep.
was mine for years, but the enthusiasm he'll bring to you. And ask him to cook you an Italian dinner because he's really good.
Yeah.
Oh, yeah.
Ed, and then Dr.
Obviously, a conversation between a patient and a doctor can be pretty intimate.
Sure.
What have you found talking with the patients? That's a big part of this equation. Do
Totally.
people have apprehension about sharing what's going on in their lives with their medical conditions to a stranger if you're going into the ER.
100%.
And not knowing who's gonna have access to this, especially if there's an insurance issue that you don't want your insurance to know about
Sure.
the pre-existing condition. I mean, the list would go on and on. So what do patients think?
Yeah, 100%. It's a really good question. Honestly, I'd be being totally frank. I think we should probably talk to more patients specifically and get an idea. I know there's already solutions in the marketplace that allow for similar things, and at the end of the day, right, we're essentially the exact same solution but enhanced on just a current piece of dictation software, right? If a current piece of dictation software is essentially you're recording your entire visit, we're just kind of one-upping that in terms of automatically generating the notes for the provider themselves.
My fear is patients wouldn't be as truthful, and they'd also say, stop that recording device, this is what I want to tell you.
It very well may be a probability. And how we'd work around that as essentially a business is still building, right, that AI automation and allowing basically gaps to allow the doctor to take notes manually if need be, right, or not transcribe the visit if need be. So essentially building into the software the ability to accomplish both tasks, making the patient feel comfortable, and then hopefully making the doctor feel comfortable too. I imagine the doctor's probably going to be like, hey, look, I want to record this because it's saving me an hour. But worst comes to worst, he just has to do the notes manually.
Okay, we're gonna wrap it up with two more questions. We got Mary and then Rod.
If you're presenting in front of investors, and if there is a person who a little bit understands AI, then she or he would ask, NLP is the most established direction in AI, along with computer vision. So, and I didn't see any differentiation. I didn't see anything which put you out of box from other companies.
Well, yeah, I mean, but at the end of the day,
question,
yeah.
Excuse me. And
Yeah.
second question, the thing which might put you out of box, this could be maybe providing APIs, as a B2B business.
Sure. Yes. No, 100%. I think providing APIs could definitely be on our roadmap. That's something that we could definitely consider if the API makes sense. If there's another business provider that would be interested in ingesting our APIs, or essentially as we're building some of these integrations, specifically with EHR software, exposing those as a unified API could be a possibility for our business. In terms of the NLP specifically, we don't see ourselves as a AI first company. Like, I am not competing with OpenAI, Anthropic on building a novel LLM model. We see ourselves as a product company that's essentially building a product specifically for healthcare clinicians, right? And leveraging that cutting edge AI infrastructure that's already there for us to leverage, right? So not competing on the front of an OpenAI, which we're building these proprietary models, but leveraging and fine tuning these proprietary models for our use cases.
Do you take any legalities in this process in consideration?
Can you explain legalities, I guess?
I mean, exactly what he was saying about, taking certain things, getting the permission, because now every time you have a minor surgery, you have to sign a form.
Sure.
Before they knock you out.
Yeah.
And those are the things that might play a role in all those other things you have brought up. So.
Yeah. So in terms of legality, from my understanding of the industry currently, there's no specific, nothing is illegal in terms of recording a transcription between a patient and a doctor. It just, in regards to A, as long as we're maintaining HIPAA compliance, and B, obviously the patient and the doctor have an understanding that they're both being recorded and they consent to that, right?
We heard a lot. Can you give us a 10-second elevator pitch?
10-second elevator pitch. I would say an AI-enabled healthcare I would just say AI-enabled healthcare. At the end of the day, I think if we're compressing it to 10 seconds, I would say AI-enabled healthcare that is going to make an incredibly inefficient business incredibly efficient.
No, that's not good.
Yeah, it's not a good one. It's fine.
We do have,
Yeah.
we've got some
Yeah.
more time because you guys are the only presenter, so we're going to subject you to more grueling punishment. I've got another quick question. You didn't have a specific ask of what you're looking for as far as, in whether it's VC funding or,
Sure.
where you're wanting to go for financially for looking for the next steps. Do you have that in mind? at this point, or is that something you're still developing?
We're entertaining, like if we're entertaining raising capital, but it's not necessarily something that we feel like we have to do.
Okay.
And our number one priority now, I think, is finding more advisors and people that we can interact with in the healthcare space specifically, right? So somebody maybe that we can add to our board specifically from the healthcare space would be something that we'd be interested in.
Okay. Yeah.
I want to answer the question about the legalities. Every time you go to a doctor, you fill out a form and ask who you want to share this information with. The doctors are extremely careful about this. They don't send or release your records to any place that you don't tell them to do so. And they're very, very, very attentive to that because they can lose their license. So that's not something you really have to worry about. They can take whatever they want, they can put whatever they want in the notes. It's private. It doesn't really matter.
So, piggybacking on a lot of these conversations, you're a patient, you go in a doctor's office, you get the clipboard.
Sure.
You got to fill out 10 pieces of paperwork, okay? Then you go to another specialist in the same office and you got to fill the damn thing out again.
Yep.
Okay? So, you're increasing efficiency within the office by getting rid of that clipboard?
Yeah, hopefully all the clipboards, right? All of the clipboards.
So a huge aspect of the success of a healthcare system is in the ability of people to early detect that they have problems.
Sure.
So a doctor getting a couple more hours a day means he's going to see that many more people and be able to give them early access.
100%.
So your elevator pitch is, we're saving lives by using AI to get rid of the clipboard.
Love it. Yeah. Hey.
I challenge that though. You're not getting rid of the signing of all the agreements.
Oh, you can put it all on pull it all on like an iPad or
Well, they already have that. Most doctors' offices, you check in ahead of time and sign everything ahead of time.
They send you a text with a link.
Yeah,
I get it.
But I'm not understanding
But,
what.
and maybe you guys can address this, because I kind of see where you're going with this, is you're still having to fill out for this specialist,
Yeah.
the information that's more pertinent to them, and that does start with name and address.
100%. I mean, long term, right? Like, it would be, in an ideal world, it would be nice to have essentially a solution where we integrate directly, and the next time you click that link, we're helping you autofill the form. Sure, that could be a potential solution in our solution
I don't see that as
suite.
your benefit. I see your benefit as having the doctor, instead of spending 5 minutes with a patient, he's able to spend 15 minutes with the patient.
That as well.
And not only have all of the notes that he has, all your past notes, have AI go out and say, hey, there's these potential conflicts. I went to my doctor and she said, well, you need to take this medicine with this medicine. I go home and look it up and they said, this is severe side effects if you do that.
Yep. Yeah.
Have your AI come through and take in the
100%.
manual, take in all these things and say, red flag,
100%.
yellow flag, green flag, all those different things. So that I see your benefit, your real punch, as we're giving you more time with your doctor and giving you better health care through AI-enabled health services, something like that.
Cool, thank you very much.
Actually, we've got a new question, so we're going to go with Jessica.
Do doctors want to spend more time with the patients, or do they feel like they're going to 5 minutes a day?
I think the question is specifically for the doctor, right? Is the doctor doesn't want to be writing notes. So the doctor doesn't want to be spending 2, 3, maybe even 4 hours every single day writing notes for every single patient visit that he had. Like that, in our at least early conversations, is a huge pain point specifically for doctors. So they would much rather have a solution that takes away a lot of that just arduous work of writing all of these notes out and basically use a solution that can accelerate that process greatly.
How many doctors have you interviewed to get that?
So right now, we're currently talking to roughly 20 doctors, yeah.
Okay. What do you call that? You got a little follow-up?
Yeah, I said so that they can do what? Like, nobody likes taking notes, I get that.
Yeah.
But like, what are they gonna do with the extra time?
What
Go on vacation, like what is?
Yeah, I mean, look, it's their time at the end of the day, right? And saving anybody time is, I would say, the most valuable thing that you can offer another human being. So,
if I give like one quick
Sure, sure,
anecdotal
go,
example,
just go
so from an ER perspective, several doctors have told us that they are so backed up on the notes because you have kind of like a revolving door of patients, that it literally is a week to 2 weeks, which is not supposed to happen, but it happens far more often than it does. And they will literally come home and spend hours on end at the end of these 2 weeks just to get these out, so they're going in right, so that it goes into the hospital's processing system for insurance. And they don't want to do that. That's like 3-4 days in a row. That's supposed to be their days off that they're doing that.
What I mean is you should clarify that, right?
Yeah.
Because some people are saying like, oh, I get more time with my doctor. But your client is the patient, your client is the
100%.
doctor.
Yep.
So you need to be
That's-
clear about that and careful about like the negative.
That makes sense.
Sure.
Yep, thank you.
So this is a question on that presentation, or not really a question, just an observation. I would take that part where you say you're targeting younger-ish doctors. That might
Okay.
give people
Yeah, you think it's throw people off.
And then on our team, I would add a CSO somewhere, even if it's just one of you guys. A lot of questions that a lot of the questions that are going to come up, especially from investors, are going to be on security and things like that. So somebody in charge.
My only experience with the dictation AI apps, I have to speak very eloquently to the app, right? And the doctor might, but what if the patient doesn't? And then the doctor has to spend even more time trying to figure out what it is that the patient's saying.
That's actually a really good question, and that's why, interesting from like a technical standpoint. One of the problems we're solving, right, is essentially leveraging that combination of an LLM, specifically with traditional transcribing NLP software, right? So even if there is, for example, a phrase that was misinterpreted by the underlying transcription model, we essentially have the LLM sit on top and basically make a grammar correction or make a correction that is making the conversation more accurate that is not possible with transcription technology alone. Yep.
If you're saving doctors about 3 to 4 hours a day that they have now freed up time for themselves, how many more patients do you think that they're able to see throughout the year?
That's a really good question.
Maybe you can lead with that.
Yeah.
Now you can see X amount of more patients per year, which is going to bring you an X more money per year.
That's exactly. I mean, you're looking for how are you going to cover the cost of your product with additional revenue.
Yep.
So if you can 10x the cost of your product with the revenue they're bringing in, which is not a problem if you're going to, my doctor's 20 minutes for notes and 3 minutes for conversation.
For conversation, yeah.
And so, then that's a straighter return on investment that somebody will work
The
with.
batting lineup is Bob, Mary, Barrett, Ed.
You really need to sell on emotion, and that gets to the heart, and people are like, man, I want to, you know what I mean? And to do that as a story, and if you don't have any case studies, you guys could be, you're the doctor, you're the patient, and going, where's your clipboard? I don't need one. Are you kidding me? How do you feel? Hey, doctor, what? I got 4 hours of, and to show the joy and the emotion of what you're both solving here. How is this possible? Well, we have the solution right here. So now I want to hear what, how did that just happen? You know what I mean? So.
Right.
Medical data is one of the very, very, I would say, dangerous data. I don't know. Along with the financial, so fintech apps and medical apps are kind of. So the question is, how do you store, manage, and secure the data? So the question is to be more clear for everyone. So there is a patient. There are 3 points. There is a patient. There is a healthcare institution, and there's a third party, which is you. Right? So how do you? So where do you store the data? Do you store it on the cloud, which is the fourth party, which is AWS? You store it in the on the servers of the institution, or is your own servers?
I mean, so it's a good question, right? I mean, if we go into the specifics, yes, the healthcare industry is very regulated. That's actually one of the reasons that we picked the business, because we believe that the barrier to entry is just naturally going to be a little bit higher, and we're going to have to compete with less AI startups essentially in this space. So we could be one of the first movers in essentially innovating here. In terms of the data security specifically, there's multiple approaches we can take. We don't have to do end-to-end encryption, but for example, we could do end-to-end encryption where the user's device specifically is the only person with that accessible information that's not encrypted data, right? So on the cloud, it could be, or wherever we're storing it, it could be totally encrypted, and it's only being decrypted specifically on the device. So we could even take that route, even though by HIPAA requirements, that's not even a necessity for us. We don't even have to do that. Does that make sense? Does that answer your question?
Yeah, we can continue. But what's the, where you,
got
how are you estimating the learning curve for the doctor to be able to accurately use the app, get the inscription?
Sure.
Like,
Yeah.
is it a learning curve?
I would imagine the learning curve is, hopefully, if we do a bad job and the learning curve is large, then that's on us to fix the software, right? At the end of the day, it's basically as simple as opening up an application, clicking start visit, and then clicking a record button, right? Where they can essentially just record the entire conversation. As soon as they're done, it'll basically, and they're like, all right, yep, done with this visit. It'll just write that entire note. Yep.
You know, the biggest challenge, at least in my book, is the referral system within hospitals. It's a nightmare. It takes 4 to 6 weeks sometimes to get a referral. Somebody has iron deficiency, it's busy and falling down. It still takes another 3 weeks. Is there anything in your program, in your system, that could speed up those kind of things, or could make it more efficient? Because supposedly they have a coordinator to do those kind of things, but if you don't have a coordinator who just does those kind of things and it's still not working, there's a problem.
Yeah. I don't, for our initial product, no, but I would say long-term, 100%, right? So as we kind of move into the back office and we see the opportunities and the low-hanging fruit in terms, like you said, in the referral system specifically, whether it's using computer vision to essentially extract and organize specific data or recommend a specific referral, that's something that I'm sure we could definitely do. It's something that I can't specifically talk on now because I don't think I have a good enough understanding specifically of the referral problem itself. Does that make sense?
Yeah, it makes sense, but it's not resolved.
Yeah, no, it's not resolved yet. I think we will resolve it. It's just not resolved yet.
And then I'm going to wrap it up.
Just to put this in perspective, I have 3 good friends who are ER docs. Their biggest complaint is at the end of every shift, on average, they're spending 2 additional hours doing notes.
Boom.
Without question.
Yep.
And I've got one guy who's semi-retired who might be good for you to talk with.
We would love to talk with him. Yep.
And hopefully you guys have gotten some good stuff out of this discussion. What else can we as a 1 Million Cups community do for you?
Introductions to anybody in the healthcare space specifically would be absolutely amazing. Yep. Okay. That's our ask.
Great. Give it up for Roll.
Yep.
You guys are on a roll.
And don't forget, guys, don't forget, we're recording this, it'll be on YouTube, so then you need to review that video and for all the feedback and everything else.
Thank you. Absolutely.